Hamika, thank you for joining. You just highlighted the growth that happened just by you seeing the need for something, bringing people together after work and things like that. But then it's more than that. You actually have a conference that takes place every year, the BHC conference, the BHC Foundation 40 under 40. That's very popular. Digital community engagement. Any story that inspire you the most from any of these programs that you always look back and say, whenever you want to give up, you're like, yeah, I have to keep doing this because of this particular thing?
No, yeah, I think, thank you for calling that out. We have been able to do a lot. After our first BHC mixer in Accra, what happened to me there, I was truly inspired. We had community members from London, from Germany, from Amsterdam, meeting people from DC, from Florida, from New York. And I was like, wow, we had to go all the way to another continent to bring all these people from different cities together. And that's when the idea sparked of, all right, well, if we're already bringing people together, we can get people to come to Ghana together and get people to come together in their cities. Why are we not bringing all the different cities in the US together? So that's when we set out to do our first conference. And we launched the Bridging Healthcare Communities Conference about 3 years ago, BHCCon in DC. Again, shout out to Howard University, right? That's the inspiration for everything in the background. So we had to be there. And in 2023 wow. Yeah, 2023 was our first conference. Had about 252 people from 26 different states, 20 different professions in healthcare. And we were able to do what we felt like was what was needed in the space, highlighting entrepreneurship, highlighting leadership, highlighting the changes in policy, right? Highlighting also what was coming clinically at the forefront, what's innovation in healthcare look like, but from a lens that was cohesive of the entire ecosystem. And even that since then has grown. Last year's conference, we had close to 600 people in attendance, almost 35 different professions in healthcare present, and almost somebody from almost every different state in the country. So it's been a great inspiration. I think a lot has come out of it. I've had people get jobs from different companies and sponsors that were in the room. I've had people that knew each other and have become business partners and built businesses from being in the space, and found investment opportunity. And it's all those things that like I truly enjoy being a catalyst for. When somebody says, oh, wow, I just got a fellowship to this program from somebody I met in a whole other state, right? Because they were at your conference. That was amazing. Or the other thing that we're super, super passionate about is supporting our entire ecosystem. So like you and I, we met at a Young Black Pharma conference or a meetup. One of the organizations I truly love, the National Medical Association, National Dental Association, and NAHSC, all these organizations that support the different areas of the ecosystem. People get to discover those organizations too, and they're in our network because we try to pull them in as much as we can. So folks coming to a BHC event and then learning about Young Black Pharma and like, wow, this is a space for me because I'm in pharma, or learning about pills, like this is a space for me, I'm a pharmacist, or NPHA, right? I'm a pharmacist, this is a space for me. So those are all things that have been amazing. Black Health Connect 40 under 40 is also a great thing. I think I've always watched the different lists pop up, creators of the year, Forbes 40 under 40. I think healthcare typically gets overlooked, even though we're at the center of so many different things. So instead of waiting for somebody to make up a category for us, like, why don't we just do it ourselves? Why don't we highlight the people that might be getting overlooked in their environments, right, in their spaces, highlight the people who are doing amazing work, bring them together. They might be resources to each other. So we've had 2023, 2024, 2025. We've had 3 classes of 40 under 40. This year is going to be our 4th 40 under 40 class, and the next year will be year 5. So super excited about that. Applications for 40 under 40 are going to open up next week. So I'm looking forward to seeing where that goes. And that 40 under 40 led to the development of our foundation. So the idea is, we can do good, right? We can do well and do good. We can have an impact. How do we mobilize the community that we're building? So on the nonprofit side, with the BHC Foundation, the 40 under 40 awards. Our gala is like a fundraiser for that, but all of our impact work sits there. So last year, the 40 under 40 gala helped to raise money for our BHC licensing scholarship. So we were able to give out $15,000 to 30 new graduates across different disciplines: social work, nursing, medicine, PT, pharmacy, dentistry, so they could pay for their licensing exams. We also do a community health fair annually in Accra. We just did one alongside the Afro Future Foundation in Accra this year for our third edition of that. But then we also do a community health fair in partnership with the Decision Project in DC alongside our conference. Right, we talk about access to healthcare and health impact. And sometimes we always think about countries externally that need support, but some cities we live in, there's environments where our communities need that support as well. So why not mobilize these networks that we've been building to have impact to give back? And that's some of the work that the foundation is doing. Super proud of what we've done so far, and excited for where we want to go in the future.
Wow, that's a lot of work, right? I see why you're very busy. I want to quickly say I'm part of your success story because I get to know young Black farmer when I came to Black Health Connect conference. Actually,
nice. Oh wow, that's amazing. That's amazing. Yeah, and those are stories you want to hear. I think the difference between BHC is that a lot of our organizations that have existed in silos, right? And even as a community, the joke I used to make is we tend to do that ourselves sometimes culturally, like, the West Indians over here, maybe Black Americans over here at times. But it's like those silos are what keep us from coming together and thinking about things. So my goal would be like, how do we bring everybody together? How do we bring the ecosystem together? Health tech, bioengineers, what have you. So it's great to hear that you're able to find your home, find your core group while attending BHC. And I think it's an opportunity for us to continue to partner with those networks